Hey guys, today I have a very important topic, one that is near and dear to my heart, a condition that I see and treat every single day when I'm in clinic. In case you didn't guess, we're talking all about skin cancer on today's video in honor of May being Skin Cancer Awareness Month. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. Now, skin cancer is the most common type of cancer that we see here in the United States. In fact, it is estimated that 1 in 5 Americans will develop skin cancer in their lifetime. So with that said, I want to talk about the most common ones that will occur that we see on a regular basis, what to look for, as well as risk factors, and then how to protect your skin from skin cancer, as well as when you should see a dermatologist. So if that sounds good to you, I would love it if you can give this video a thumbs up and don't forget to subscribe. Okay, let's start with the basics. What is skin cancer? So cancer essentially just means abnormal malignant growth of cells within our body. We hear about like breast cancer, lung cancer, and similarly with skin, there are different layers to the skin and lots of different cells within the skin. So, technically any of these cells could go bad and grow abnormally. And they can sometimes, but those are rare. The most common types of skin cancer that we see here in the US that we treat as dermatologists are really cells derived from the epidermis, the top layer of the skin. That being number 1, basal cell skin cancer, 2, squamous cell skin cancer, and then 3, melanoma, with the latter, the one that people kind of think about when they think about skin cancer, because it is often talked about more in seriousness because it is one that can potentially be deadly and kill individuals. And we've definitely seen people die from melanoma. And so these are the 3 most common skin cancers, with actually basal cell being the most common type of cancer that affects individuals here in the United States. Now, when we talk about skin cancer, we tend to associate individuals who have lighter skin tone, fair skin, being at higher risk, and that is true. However, skin cancer can affect anyone, any background, any ethnicity, any skin tone. And I definitely have treated plenty of patients of darker skin tone that had basal cell skin cancer and melanoma. So it's really important to know the types of skin cancer and the risk factors that may predispose one to develop these types of skin cancer. So let's talk about that next. Okay, now let's talk about the cause and the risks for developing skin cancer. We do know that 80% of skin cancer is caused by exposure to UV radiation. Certainly when it comes to UV radiation, the first thing we think about is the sun. But actually tanning bed is a strong source of UV radiation. In fact, often even stronger than UV exposure from sun because it's a lot more intense. Which is why as dermatologists, we really talk about the importance of not using tanning bed, avoiding blistering sunburns, and tanning. And there's no such thing as a safe tan because tanning essentially is skin damage. And, hammering home the importance of sun protection. To give you some ideas, 1 blistering sunburn in your childhood can double your risk of developing melanoma and skin cancer later in life. Using tanning bed before the age of 20 increases your risk for developing melanoma by 47 to 50%. Now, there are different types of risk when it even comes to sun exposure. Chronic sun exposure will increase your risk for developing squamous cell skin cancer versus intermittent blistering sunburns. Like you may not tan for those who are super fair, but if you get few blistering sunburns throughout your life, that significantly increases your risk for developing basal cell skin cancer. Now, certainly genetics do play a role, not only inheriting that fair skin and that tendency to burn and not have melanin to protect your skin, but there are actually genetic mutations that could predispose individuals to developing skin cancer. And usually those are kind of more around melanoma, having a lot of abnormal moles, developing melanoma, as well as other cancers that could be associated with that gene mutation. We tend to see this usually in patients that have a lot of moles, a lot of abnormal moles, and then a first-degree relative, usually mom, dad, or sibling, having had melanoma or other cancers associated with this genetic mutation. Now, another risk that we don't often think about that isn't as relevant, as common, but can happen is in individuals that have chronic inflammatory skin conditions that are not well managed, for example, lichen planus, technically even like psoriasis, or wounds like burn scars. Because of basically the significant damage to the skin, inflammation, skin cancer could arise in those areas, and usually those are squamous cell skin cancer. And we do know that when cancer arises in those areas, it can be a lot more aggressive. And so I always tell my patients, if you ever notice a new bump in your like burn scar that is not healing, bleeding, hurting, that needs to be checked out, and that needs to be checked out very quickly. So essentially, to summarize, individuals who are at risk for developing the most common types of skin cancer would be individuals who are, again, fair skin, but anyone that basically has had a lot of chronic sun exposure or intermittent and chronic sun exposure, blistering sunburns, tanning bed use, as well as a first-degree relative who has a history of melanoma. Okay, now let's talk about the 3 most common types of skin cancer here in the United States and that we treat daily as a dermatologist. Number 1, the most common is basal cell skin cancer. As the name implies, this is derived from cells in the basal layer of the epidermis. This is the most common type of skin cancer, but also the most common type of cancer here that we see here in the United States. And the good news is it's the least dangerous of all skin cancers. In the sense, often when patients come to me with a basal cell skin cancer that looks like basal cell, chances are they've probably had it for at least 6 months to a year or even longer. I've seen people that have had like a sore on their back for 5+ years, which, they're still doing well, which is really unheard of with other types of cancer, right? And so because basal cell is fairly indolent and slow growing, and the risk of them getting deeper into the skin or metastasizing is very rare. I treat skin cancer. I've treated thousands of skin cancer, throughout my training and practice, and I have really, rarely, if ever, seen a basal cell skin cancer causing someone to die. Now, with that said, it is still very important to have that identified and treated, because I've also seen, because of that, people lose their eyesight because the basal cell skin cancer was their eyelid, it was neglected, eroded into the lid, or say caused destruction of their nose. So what would happen with basal cell skin cancer over time is, if it's neglected, it just gets bigger, would bleed, be painful, but also cause big erosions on your skin that can lead to secondary infection, as well as basically destruction of the local tissue. Basal cell skin cancer, the risk factors that we discussed earlier, most common is from UV exposure, so sun, tanning bed use, and those intermittent blistering sunburns. So with that, most common areas are sun exposed. So, the scalp, face, ears, chest, arms, shoulder, back, legs. But basal cell skin cancers can also come in other areas, pretty rare. I've actually treated individuals that have had basal cell in their groin, but those are far less common. So what to look for when it comes to basal cell? There's very different types, but the most common is a pink, shiny, or we call pearly papule or bump. Sometimes it'll have like a central dell, or what we call umbilication, that may erode in the middle and bleed. So I tell my patients, if you have any pink bump that doesn't go away in 3 to 6 months, that looks friable, would bleed easily without you picking or touching it, that needs to be checked out. A lot of times patients come to see me and say, hey, I've had this bump now for like 8 months. I thought it was a pimple, but it hasn't gone away. It's starting to hurt and it's bleeding. And then we look at it and it looks very suspicious for basal cell skin cancer. Now, there are other types of basal cell skin cancer. I won't go into the details, but like pigmented skin, basal cell, micronodule, all of that. But the most common is like a shiny pink bump that basically will continue to grow slowly, may bleed, may hurt. So if you have that, especially in sun-exposed areas, then that definitely needs to be checked out. Your dermatologist will go ahead and take a biopsy to confirm, and usually with treatment, depends on the size and the location, but things that we do would be surgery, Mohs, micrographic surgery, sometimes even topical chemotherapy creams, or even something called electric desiccation and curettage. So there are lots of different ways. It just all depends on the size and the location. Next is squamous cell skin cancer that is essentially derived from epidermal cells within the top layer of the skin. Squamous cell is the second most common type of skin cancer, and together with basal cell skin cancer are the two most common types of skin cancer that we diagnose and manage on a regular basis as dermatologists. Now, even though squamous cell skin cancer, like basal cell, for the majority, once they're identified and treated, they're just locally destructive. They're not as dangerous as melanoma. However, squamous cell is one, if you let it go for too long, depending on the type and the location, it can metastasize, and I've seen that happen, and can be deadly. A precursor to squamous cell skin cancer we call actinic keratosis. These are kind of gritty sandpaper-like bumps, sometimes better felt than seen, that if you get skin checks regularly, this is where your dermatologist may come at you with that like in cryotherapy torch and burn off, because the precursor to squamous cell is actinic keratosis. And when you have a lot, chances are you have sun damage, that skin area may develop squamous cell, or any one of those keratoses, actinic keratosis, may turn into squamous cell skin cancer. The cause of squamous cell skin cancer is chronic sun damage. So instead of intermittent blistering sunburns with basal cell, it's long-term UV exposure over time. So with that said, like basal cell, it's commonly sun-exposed areas, but forearms and hands, people that drive, or farmers, these are areas that we commonly identify, in addition to like the chest, the face, the ears, and scalp. And this is also where I mentioned earlier, less common, but chronic inflammatory conditions that are now well controlled, or like wounds, sores, like from trauma or burn scars. Squamous cell can certainly develop in those areas, and that squamous cell that do arise in those spots tend to be a little more aggressive and have higher risk of metastasis. So squamous cell is one that, for the majority, if you have any spots that's concerning, have it checked out, and by treating it, it's not dangerous. But if you let it go for too long, depending on the type and the location, it could potentially metastasize. So squamous cell skin cancer usually presents as a pink scaly patch, and sometimes it's mistaken for eczema or a rash. So this is where if you have a pink scaly spot that you've had for a long time, that is just not going away at all, starting to maybe thicken up a little bit, may bleed, is tender, it's time to have it checked out. Certainly, like basal cell, there are different subtypes of squamous cell. There's even one that is called a keratoacanthoma that basically comes up as a pink juicy bump, comes up very quickly, and almost kind of outgrows its nutrition and blood supply, and then kind of will slowly regress a little bit. So there are lots of different types, but the most important thing, like basal cell, is if there's any pink sore spot that is new, that is changing, that is bleeding, tender, and not healing, then you need to have it checked out. Lastly is melanoma. I think this is a lot of people, for many individuals, when they think about skin cancer, they often just think that there's melanoma. But actually it is the most rare type of all three, even though it is still fairly common that we see regularly as a dermatologist. And I think it's good that people really have melanoma associated with skin cancer, period, because it is the most serious one. And if it prompts one to get their skin checked, then I'm all for it. But in reality, melanoma is by far less common compared to squamous cell and basal cell. Now, melanoma is derived from melanocytes. So those are the pigment creating cells that give us our hair color, eye color, and skin color. So with that said, even though individuals that have had tanning bed use, like we mentioned earlier, a lot of sun exposure, they're higher risk for developing melanoma. This type of skin cancer can affect anyone. And in people who are darker skin, it tends to affect potentially their hands and feet, the nail unit. And this is one that actually killed Bob Marley. So it can affect really anyone. Now, the most common melanoma obviously arise from on your skin, and it can arise from normal skin, or the other 50% of the time it can arise from an abnormal mole. And so going back to melanoma, this is where I tell patients, even though there are lots of different subtypes, you want to look for a mole that looks abnormal, that is growing, that is new and changing fast. Reasons being, when you see that, you want to have it checked out immediately, because melanoma is one that if you neglect, it will get deeper, it will metastasize, and this is where it will be deadly. And this is also where, if caught early and it's very superficial, that often means overall it's a great prognosis. And so when we see any sort of changing spot, concerning spot, we will biopsy it. If it's a melanoma, we will tailor the treatment based on depth of the skin cancer, of the melanoma. So if it's superficial, it just means a big wide local excision. If it gets deeper, it's wide local excision and a sentinel lymph node biopsy of that draining lymph node to that area to make sure that melanoma hasn't metastasized. So this is where really early intervention is key. I do want to briefly talk about 3 different types of melanoma, even though there are more than that, like basal cell squamous cell, but the 3 most common types I find to have the most clinical relevance. Number 1 is just the most common type of melanoma, which is superficial spreading. This is often found in sun-exposed areas, so arms, body, face, legs, common area for women, and usually presents as an irregular, fast-growing dark spot. Now, often patients, we may catch it on skin checks, or patients will come in and say, hey, this is really dark, it's new, it's changing fast, and this is the most common type of melanoma. And if it's caught early, overall has a really good prognosis. The other one is called lentigo malignant melanoma. This is often found in individuals who are older. Unlike superficial spreading that can affect anyone, even younger individuals, lentigo malignant melanoma usually is derived from a lenticle, so usually a sunspot. So we usually see this in individuals who are older with chronic sun exposure, and with repeated unprotected skin, that solar lenticle kind of starts to slowly morph into a melanoma. So that solar lenticle is no longer uniformly brown, but is starting to develop irregular shape as well as color to it. So this is, again, even a sun freckle, even though you've had it for a long time, if it's changing, getting darker, growing, time to have it checked out. The last one I want to emphasize because it really affects individuals of color, and that is acral lentiginous melanoma. This is the one that killed Bob Marley. So the melanoma that comes on our hands and feet as well as the nail unit. And these are often areas that we don't think about, that we may not check regularly. So, make sure that when you are looking at your skin, look at the bottom of your feet, or if you do get your nails done regularly, at least look at your nails to make sure that there aren't any dark bands that's on your nail. Now, I personally have a lot of dark bands. That is called melanonychia. That is actually not uncommon, especially for individuals that have more pigment to their skin. So Asians, Hispanics, and Blacks. Essentially, it's like having a mole in your nail. And there is a genetic predisposition to how much you get, but it is common to have this, and it's normal for people of color. In somebody who's fair skinned, who's Caucasian, who's white, having a band usually is not uncommon. So if you do develop a brown band, especially if it's one in isolation, you definitely want to see your dermatologist. Now, having said that, if you have any dark band in your nail that is new, growing fast, and it's kind of affecting into your cuticles, like that color is going into your cuticles, it is time to have that checked out. You need to have it evaluated by a dermatologist because, like I said, nail unit melanoma is definitely something that is usually diagnosed late because we just don't think about it, and can be deadly, especially affecting individuals of color. So what should you be looking for when it comes to melanoma? Number 1, we kind of say the ABCDE rules. So what is that? A stands for asymmetry. So a mole that is asymmetric in size, color, and shape, right? And B is the border. It's got funny borders kind of going along with the asymmetry, like sometimes even scalloped, like somebody's taking a bite out of it. 3 is color. So common colors would be, reddish brown, pink moles, dark brown. But if it's got like grays or blues in there, then it is concerning. D is diameter, so the cutoff is 5 to 6 millimeters, so that's usually about the tip of a pencil eraser. So bigger moles if it's growing. And then E is actually what I like to rely on, which is evolution. If you have something that is growing and growing fast, like literally double in size within a couple of months, that needs to be checked out. Now, the ABCDE rule is very general, and when I tell my patients, I always caveat that. And actually, what I like to use most, aside from the E, the evolution, is the ugly duckling sign. So we all are unique, and all of our moles are different. And some people just may make really big pink moles at baseline. But if that is what you make, and you have a lot of moles that look like that, chances are those are fine. But if you make like reddish brown moles that are big and all of a sudden you notice a jet black one on your skin, that needs to be checked out. So any mole that you notice that is new, that really stands out, that doesn't look like the rest of what you make, so the ugly duckling, I really recommend having that checked out, especially if you have a family history, first degree relative with melanoma, you have a lot of abnormal moles on yourself, or have had even prior diagnosis of what we call atypical moles, or have had a lot of like sun exposure, blistering sunburns, and tanning bed use, definitely recommend getting a skin check and having that looked at. Okay, so we've talked about the skin cancer. We know that 80% of skin cancer is caused by sun damage. So what can we do to, in many ways, prevent skin cancer, because it is definitely preventable? Number one is just being good about sun protection. And this is why, like I said, we always emphasize the importance of wearing sunscreen, sun protective clothing, and just being smart about being out in the sun. Wearing sunscreen every single day, because you just never know where you're going to be when there's going to be sunlight out. In fact, we know that individuals are way more likely to get sun damage and skin cancer on the left side of the face because of driving. And even though you're not in the sun, a lot of people associate like you have to be directly physically out there in the sun to get sun damage. Sunlight comes through windows. We know that UVA rays penetrate through clouds and glass, and so it can definitely cause skin cancer. So being good about wearing sunscreen every single day, like we brush our teeth every morning, get in the habit of wearing sunscreen every single day. Now, this is for kind of daily. If you work, you're not like outside on vacation, then certainly reapplying before your long drive home, especially in the summer, I think it's helpful. But if you're going to be outside, you're on vacation, it's summertime, not only making sure that you apply sunscreen, but also making sure you reapply every couple hours, making sure that you are wearing water-resistant formulation that sticks on your skin better, and also making sure you're using adequate amounts. A lot of time patients come to see me saying, hey, I'm wearing sunscreen, I'm reapplying, I'm still getting burnt. Chances are you're probably not using the adequate amount. What does that look like? For an average adult, it's usually about 1/4 to 1/2 teaspoon of sunscreen for the face, the head and neck area. And then about another like teaspoon per arm. And usually that equates to like 1 ounce, so shot glass full of sunscreen for the entire body for an average adult. And then certainly like reapplying every couple hours. Now, if you're outside, swimming, running and stuff, keep in mind that sunscreen, as good as they are, they're not 100%. So this is where we also encourage wearing some protective clothing, a wide rim hat to protect, in addition to some sunscreen, because sunscreen, as good as they are, only will offer up to 98% or 99%, and we know majority of the individuals, they don't wear enough and they don't apply frequently enough. So some protective clothing on top of sunscreen is going to be additionally helpful in offering kind of that layer of protection to your skin. And additionally, last, a few other tips. You don't have to be a vampire, but just kind of be smart about when you're in the sun. Try to avoid 10 to 2 the hours, like 10 a.m. from 2 p.m., where we know UV radiation is going to be the strongest. And if you are going to be out and about during those hours, trying to minimize your direct time in the sun, seek shade when possible. Shade does provide a little bit additional protection. It's not 100%, but all those things are going to be helpful in the long run. Now, when it comes to sunscreen, I know it is so important to find one that you love, because really the best sunscreen is one that you enjoy using, that you will want to wear on a daily basis. So I'm going to give a few recommendations, but at the end of the day, it may be a little trial and error. You just have to find the right one that fits your skin that you like. Number one, it's a great daily sunscreen that I think is suitable for majority of individuals. It's really nice and elegant, suitable, and really ideal for daily use for those individuals that kind of just want to use a sunscreen to protect their skin, wear alone, wear under makeup, who are not really spending a lot of time outside, maybe some driving, but for the most part are working indoors. And that is Beauty of Joseon, the Rice Plus Prebiotic Sunscreen that is SPF 50 and PA4 pluses. I mean, for $15, you can't go wrong. It is creamy, hydrating, but not heavy or thick. And it has great chemical filters that are effective, that leaves no white cast. It is also fragrance free and really suitable for those with sensitive skin. Ingredient wise, it's got 30% rice extract that is really helping to nourish and support the skin barrier. Also has niacinamide that also offers antioxidant as well as skin barrier support benefits, along with other blends of antioxidants and green tea extract, lactobacillus, glycerin. I mean, this one is like, I don't really need to go in more. I feel like we all know how nice and elegant it is, and it's certainly one that is really ideal if you're looking for one that is just really nice to use on a regular basis. Next is one of my all-time favorites for the summer to use on face and body for ultimate protection when I'm out and about with my kids or on vacation. And it's the La Roche-Posay and Helios Melted Milk SPF 60. This is just such a nice, elegant, fast absorbing, non-greasy, non-sticky. It literally feels like you put nothing on your skin, especially on body. And I'm very picky because I hate that sticky feeling when it's hot and humid outside already, and having that sunscreen feeling that way on my body. This one will give you none of that. It's got elegant chemical filters, and it gives you high protection SPF 60, which is great for summer. It's also water resistant up to 80 minutes. And La Roche-Posay has the Cell Ox technology that combines their filters along with the plant-derived antioxidants that basically combined, we know, gives additional protection against UV radiation. And that's been seen in laboratory and clinical studies. Also has vitamin E that's great at soothing the skin, offers additional antioxidant benefits. And dimethicone, along with La Roche-Posay's thermal spring water. But what I love about this is, number one, high SPF, water resistant up to 80 minutes, and the fact that you can use it on your face and body, so one-stop shop, and it literally leaves no residue on your skin. So really ideal if you're looking for an elegant sunscreen to use all year round, especially during the summertime when you're gonna be out and about. And lastly, for those looking for an elegant mineral sunscreen to use, whether because you're super sensitive or like chemical sunscreen breaks you out, highly recommend one from Ulta MD UV Clear Broad Spectrum SPF 46. Pure mineral zinc oxide filter along with niacinamide, vitamin E, and hyaluronic acid. That is just really lightweight, leaves no white cast, suitable for oily, acne-prone skin as well. Great, again, to wear alone or under makeup. So this is one I highly recommend. Ulta MD makes really nice, elegant, chemical-based sunscreens. So highly check that out. Now, when it comes to sunscreens too, I think it's really nice to have a different type, especially for like applying that good first layer, but then also for ease of application or reapplication, I should say. And there are different ways of going about doing so. Now, if you're outside, you're swimming and running, I do recommend the best way to make sure you're getting adequate protection is just go ahead and reapply your sunscreen cream or lotion, for example, like using that La Roche-Posay and Helios. However, if you're like mostly indoors, or say you just can't use your hand is dirty and you're in need of applying sunscreen, this is where I absolutely love sunscreen powder as well as sunscreen sticks for that reason. And one sunscreen powder I really love that I've talked about before is from Color Science. Their sunscreen powder is really nice and elegant. And that powder, a couple of things. Number one, I like this sunscreen powder actually does not expire. I believe speaking to Color Science, their formulators, it does not expire. But two, it actually gives some mattifying properties. So for individuals who gets oily throughout the day, this powder not only will help to kind of offer additional UV protection, but also can help to mattify your face. So this is a great one. It's also mineral based. I also love the fact that it comes in tinted and non-tinted. And the tints, there's a range of different shades you can select from. So it's almost like powdering your face, and that tint also provides additional protection against visible light. The thing to make sure when you are using a powder sunscreen of any sorts is you want to give it adequate time. And the only brand that's done studies to prove that their sunscreen powder is equivalent to, what's designated on their label is basically color science. And you have to basically powder your skin for basically 60 seconds. So if you divide your face equally into like 4 quadrants, like 15 seconds per quadrant is usually what we recommend. And I think that is what color science recommends as well. Sunscreen sticks are another great way to reapply sunscreen. I actually find them to be really helpful, along with powders to like the non-tinted for kids, because I find that for my kids, it's really entertaining, it's fun. Also, it's a way of encouraging them to kind of learn about sun protection and how to protect their skin better. There are lots of different sunscreen sticks. I will list a few of my older videos below, but literally you can find ones from like Cetaphil to Think Baby to Mistela that are great for kids, to Ulta MD, as well as some of the Korean ones. There are a ton, like Beauty of Jason, that is really nice and elegant and mattifying. So just pick one that I think is suitable for your skin type, or one that you can use on the whole family. But those are also great ways, and you really want to, similar to the powder, make sure you give 4 passes on each area to get the adequate protection that you need from the stick. Now, one thing, if you're just not in a habit of reapplying your sunscreen and you need a reminder, I highly recommend these Spot My UV detection stickers. Essentially, you can put them over your skin after applying sunscreen. Essentially, will turn clear once you have the sunscreen on. And essentially, it has like a skin mimicking sunscreen absorbing technology that will turn color after your sunscreen has been used up in that area locally to remind you to reapply. So this is really neat way to basically remind yourself to reapply. So when you see it change color, then you know it is time to reapply sunscreen. And this one does work. It like if you're outdoors, sweating through swimming, so just all around a great reminder if you need. And lastly, one supplement I recommend as additional kind of cherry on top for those who are going to be outside for extended period of time, who want additional protection. I also recommend this to my melasma patients to offer additional protection during the summer when we know there's more UV light around. For anyone that have like sun sensitive conditions but are going on vacation and know that they're going to get more sunlight exposure, is HelioCare. This is a supplement that's been shown in clinical studies to reduce UV damage and sunburns. It's derived from a fern from South America called Polypodium leucotomus. It is not a replacement for sunscreen. However, when taken with sunscreen on top of sun protective clothing, really essentially is an oral antioxidant supplement that can offer additional protection against damage. So you can think of it as a practical way to reduce the risk of skin cancer, but also, like I said, I use it in aesthetic dermatology in the sense helps to reduce melasma flares during the summertime. And certainly if you want less sun damage for like anti-aging concerns, this would be a great one. You can take it every day, but I find it to be, for me, most doable when I know, and I will often take one when I know I'm going to spend all day outside in the sun as additional protection for my skin. You essentially just take 1 to 2 as needed when you need to. And last but not least, don't forget sun protective clothing. They're a great way to protect your skin, offer additional protection, or if you're really not good about applying sunscreen, don't want to forget to reapply, sun protective clothing like long sleeve shirts, and a lot of them are really lightweight and elegant, can be a great way to protect your skin without having the need to reapply sunscreen. In fact, that is what my husband does in the summertime. He only puts sunscreen on his face and ears, and he will just literally go around long sleeve and long pants. I mean, he is sweating buckets, but that is his choice, and he's actually, his skin, he has never been burnt. And so this is one way where it can be really helpful, and certainly like for little ones who aren't as good about, reapplying sunscreen or just applying sunscreen, sun protective clothing like rash guards can be a great way. So that way you can, at least as parents, minimize the areas that you do have to apply sunscreen and reapply sunscreen on, because certainly I understand with 2 little ones, sometimes can be it's a chore to apply and reapply sunscreen on your kids. There are lots of different brands. 2 that come to mind that I love that offer not only great elegant clothing, shirts that are lightweight, breathable, great to use in the summertime, pants, as well as rash guards for swimming, but also lovely hats of various different styles. One is Coolie Bar, and the other one is Bari. I think that may be an Australian brand, but I really love their hats. And I'll definitely link more below in the description box. But yes, I personally love sun protective clothing. I will always go outside with sunscreen on. And top of that, I will never forget my wide brim hat as additional protection for me. All right, guys, that is it for today's video. I know I got a little bit long, but I really want to emphasize and talk to you guys about skin cancer, like the different types, what to look for, when to see a dermatologist, as well as what you can do, because majority of the skin cancer is truly preventable. I will link everything below that I've talked about today. Also, if you enjoyed this type of more medical dermatology videos, comment below and let me know what you want me to talk about next. Again, thank you so much for watching, and I'll see you next time.